I've been grinding my teeth now for about 10 years. I've gone to the dentist with symptoms of needing a crown or a root canal, but the dentist informs me that I'm wearing away the enamel on my teeth simply by grinding them at night. Is there a way to stop grinding or to at least lessen the grinding?
Long-term grinding is no good, so we reached out to dentist Dr. Chris Strandburg for some tips to help stop the grind.
I heard you wanted to know a little bit about teeth grinding. You can have bad consequences from grinding your teeth. You can break your teeth, you can get morning headaches, and you can cause permanent jaw joint pain. But I've got some tips for you that I think will really help. Tip number 1, Botox. Believe it or not, putting Botox in your jaw muscles can really help you. It shrinks the size of your jaw muscles so that they don't develop as much pressure. And less pressure grinding means less chance you're gonna break a tooth. Number 2, medications. Anti-anxiety medications in a lot of people cause tooth grinding at night. There are good alternatives. Check with your doctor. You might be able to find a medication that helps you with your anxiety and won't make you grind your teeth. Number 3, you gotta reduce your stress. Having a relaxation period an hour before bed where you wind down is really helpful. Also, you got to avoid extra caffeine and alcohol because both of those can cause you to grind your teeth throughout the night. So, if you relax a little bit, I think you'll sleep really well without grinding your teeth.